And on the next slide. Great. So I want to start the presentation tonight with some good news. So we talked back in February about one of our very successful HHR strategies that we've been utilizing throughout the pandemic, and that was our UNE, or undergraduate nurse and undergraduate respiratory therapy employee program. So those staff have been really critical. We shared with you some great feedback and videos from those staff. And not only did they help us during the pandemic, but quite a number of them have signed on and become now our staff that they've graduated. So it's been a great recruitment initiative. So we were happy to receive notice this month that the funding is actually being extended through the end of September this year. And we are hopeful that the overall Ministry of Health plan to strengthen health and human resources will continue this onwards. So that was some good news that we got. Next slide, Matt, please. So I'm going to talk a bit about tonight, just to refresh on some of the assessment, treatment, testing, vaccination resources in the community, especially as we look like we're going into another wave, just to ensure everybody is aware of the resources that are available in the community. So I do want to talk a bit, just to start, about our MAT COVID Assessment Center. So you'll recall the Puma Clinic. So that was situated in a trailer outside the emergency department, and has been since August of 2021 over 8,500 patients. And they focus on the care of patients aged 3 months to 17 years. And it was such a success, and it was so appreciated by the community, that we've now moved it into our pediatric outpatient department as a service that's provided within the metropolitan campus. So the pediatric team has done a great job in incorporating that and really accommodating those patients as part of their ongoing strategy for the pediatric population. And then, of course, our Elect Campus AC, which is located adjacent to the emergency department. And they have seen over 140,000 patients since we opened, just to kind of give you a frame of reference for the demand for the service in the community. So what's unique about our COVID centers is they're not just testing centers. We've always offered assessment by clinicians, by physicians, and that has really allowed us to move onwards as research expands with this illness. So I do want to start with just the criteria for testing, because I know a lot of people are challenged with whether or not they can get a test and when. This information is all available at the link that I've included in the slide. So I've included a lot of links so people afterwards can access those directly for more information. But the testing is really focused on people that are either working or experiencing high-risk situations. So really focused on healthcare workers, those that are working in high-risk settings, home or community care, someone that's living with a patient-facing healthcare worker or worker in the high-risk setting, outpatients that are being considered for COVID-19 treatment or requiring a diagnostic test for clinical management. And I'll come back to that one a little bit later, because that's really important when we talk about treatment. If you think that you are eligible for COVID-19 treatment, that means you are also eligible for a COVID test. Because of course, one of the treatment parameters is you have to have tested positive for COVID. Any outpatients requiring diagnostic tests for clinical management, temporary foreign workers living in congregate settings, underhoused or those experiencing homelessness, if you are pregnant, a first responder, including firefighters, police, and paramedics, any elementary or secondary students or education staff that are utilizing the PCR self-collection kits provided by the ministry, and then other individuals that might be directed for testing by the local public health unit based on outbreak investigations or high-risk settings, etc. Next slide, please, Matt. So whether or not you have symptoms, you're also eligible for testing if you are an individual from a First Nation, Inuit, Métis community, or self-identify as First Nation, Inuit, and Métis, or their household members. You're an individual traveling into those communities for work, are being admitted or transferred to or from a hospital or congregate living setting, are a close contact of someone in a confirmed or suspected outbreak in a high-risk setting or other settings if directed by the health unit, You're receiving out-of-country medical services. That's been approved by OHIP or our caregiver for someone who does. Or if you're in a hospital, long-term care, retirement home, or congregate setting, that's been directed by public health unit, provincial guidance, or other directives. So it's a long list, but it can be a bit confusing. So I wanted to make sure that we covered that tonight and provided the resource if you're not sure. Next slide, please, Matt. So when we're looking at testing, where can you get tested? So we have a number of locations throughout Windsor, Essex. We're very lucky that we have a number of our facilities still providing ongoing assessment and testing. So we have our OLET and MET campus, as we talked about. You can book an appointment online or call the number that's listed there. And that's open Monday to Friday between 8 and 4 for phone calls. Of course, the clinic hours are 7 days a week. Our Erie Shores Healthcare COVID-19 Assessment Center is available, and the location and hours of operation are available on their website. We have very close partnership with MedLabs of Windsor. They have locations in LaSalle, Windsor, Tecumseh, and Leamington, and their testing location location and information is available on their website, as well as their Southwest Ontario Aboriginal Health Access Center. They offer COVID screening and testing by appointment to our First Nation, Métis, and Inuit community members, and you can schedule an appointment by calling the number there. There are also a number of retail pharmacy locations across Ontario offering COVID testing for symptomatic, not just travel, and you can find those by clicking on the link there and entering the address of the location that you're looking to attend. Next slide, please. So let's talk about treatment. There's been a lot of advances throughout the pandemic with regards to both medical treatment as well as medication-related treatment. And as we told you back in January, we were one of the first hospitals that started offering monoclonal antibody and Paxlovid treatment in our clinic. And since that time, we've given 49 monoclonal antibody treatments as well as 19 Paxlovid courses to patients in our community that were experiencing COVID. So we do screen all patients that come through our COVID assessment centers for eligibility, but in addition to that, patients can self-refer. So anybody that meets any of the categories that I'm going to review, that you think you might qualify for treatment, we do encourage you to book an appointment with our assessment center, bring a list of medications and your current medical conditions. You may be required to get a COVID test if you haven't had one already, and we have our physician and our clinical staff will review the criteria with you. We can get all of your lab work done, and we can get you connected for whether it's the monoclonal or Paxlovid therapy. We also support the other hospitals in the area of St. Clair with regards, we are a depot for Paxlovid and MAB, so we do support those hospitals in being able to also offer those two therapies. So we're working closely with those as we expand the criteria for treatment. So to qualify or be considered, sorry, of course, my screen goes black. You have to have immune compromise or be unvaccinated or partially vaccinated, have one or more risk factors such as long-term medical condition or being of older age, and are Indigenous, Black, or a member of another racialized community. So those are some of the high-level risk factors that can make you eligible for treatment, but there's a much longer list that we will go through with you if you present to our clinic. So anyone thinking that they're higher risk should either contact a healthcare professional to be assessed as soon as possible, because there are time restrictions for initiation of treatment. So they can either contact their own primary care provider, contact telehealth, or visit a COVID clinical 19 assessment center. I've also included the referral form for primary care providers in the community that may want to refer a patient to our assessment center, and also the science table guidance document, which was just updated with new remdesivir guidelines for the BA2 variant. Next slide, please. So I want to talk a bit about vaccination now. So we've talked about treatment. Let's talk about prevention. So as you know, we recently closed down the Devonshire mass vaccination site, but there are still lots of vaccination options in the community. But since we started Windsor Regional Hospital administering the COVID vaccine, we've administered 365,171 COVID-19 vaccines. And we've done that at multiple locations, including the St. Clair Sportsplex, Windsor Hall, Devonshire site, and also at Windsor Regional itself. So if you're a patient here at the hospital, if you haven't been asked, please ask your healthcare provider and we will provide that to you while you were here. And I want to recognize again, we have partnered with multiple community agencies to accomplish the amazing vaccination rates in Windsor Essex, including St. Clair College, the University of Windsor, the City of Windsor, and Michu, and many others. So you can get your first, second, or booster vaccines at the following locations. We have the 2 public health units, one in Leamington and one in Windsor, and the instructions are listed there on the slide. And as well, I want to highlight there are 2 pop-up vaccine clinics tomorrow, Friday, April 8th, one at Addie Knox from 9 a.m. to 2:30, and one at Windsor Waterworld from 9 to 4. And then we also have participating pharmacies and healthcare providers that you can find by clicking on the link below. And last but not least, with regards to this, please don't forget, for those that require it, there's still assistance with transportation, language, and childcare services available. So those that need those supports in order to be vaccinated, please click on the link for that information. Next slide. Just a review for the COVID-19 vaccine recommendations and eligibility. So I've highlighted in red there, as of today, individuals that are 60 or older are now eligible for a second booster or a 4th dose, as long as it's 5 months after their 3rd dose. So that was effective as of today. And I'll just go quickly through the recommendations. So 5 to 11 is still a 2-dose primary series. The 2nd dose 8 weeks after the 1st. They're still not recommending boosters except for those that are immune compromised. Age 12 to 15 is a 2-dose primary, 2nd dose 8 weeks after the 1st, with a 3rd dose 6 months after the 2nd dose for 12 to 17, or 3 months after your 2nd dose for 18 or older. And a 4th dose for this age group is being recommended for our First Nation, Inuit, and Métis individuals and their non-Indigenous household members that are over the age of 18. And last but not least, are individuals aged 60 or older, a 2-dose primary vaccine series, 2nd dose 8 weeks after the 1st, a 3rd dose 3 months later, and now the 4th dose at 5 months after your 3rd dose. Next slide, please. And this is the end of my presentation. This is just a picture of one of our many boards at one of our vaccine centers thanking us for their vaccines that they got. And I just want to again thank our community for their great uptake with vaccination. And please, once again, like Anthony mentioned at the beginning, please do get your vaccines. If you haven't gotten your shot already, please start. It's not too late. And if you're due for a booster, please do that. Thank you, Mr. Chair.
Thanks, Karen.